This framework is important because it allows us to bring together all of the work that's going on in our services in relation to recovery. We know that there are many services doing lots of good things around recovery, but we don't have a uniform way of driving recovery across all of our services. So this is really a working framework that will allow services to really achieve certain actions so that they're actually ensuring that the 4 key principles underpinning this framework are being delivered on. For me as National Director, it allows us to look through, I suppose, a common lens with all of our services and to bring some level of consistency for service users regardless of where they attend in the country. So it's a really positive event for mental health services in Ireland. It signals a great change in our culture and in how we do our business. So for that reason it's really important.
The framework for recovery gives us an agreed understanding of what we mean by recovery. And that understanding is that the service user themselves defines what recovery means in the context of their own lives. It relates to the goals and ambitions that they have in terms of things relating to work, where they live, how they will interact with their local communities. I suppose what the framework also provides then is an understanding of how services and service providers should respond to that service user defined recovery. And the role of service providers in that context is one of enabling and facilitating that self-determined understanding of recovery. It ensures that happens by supporting the process of recovery through a number of stages. The first of those is hope, that the person realises that recovery is possible. The second stage is empowerment, and that's giving the person the opportunity and the resources to begin to explore and define what recovery might mean for them. And the third part is about allowing people to self-determine what that recovery is, to go out and achieve that. And that's done, I suppose, from a service provision by ensuring that it's contained in their care plans. The first principle of the recovery framework is the centrality of the service user experience. And that ensures that the person with the lived experience is at the centre of the recovery process. It allows them to explore what their experience of their mental health condition was like, what recovery might mean for them. Their experience can inform the design, delivery and evaluation of services. So it's very important that we capture that service user experience, as they are the experts on recovery, and that needs to be put at the centre of service delivery, which it is by this first principle.
Well, it starts from every clinical encounter and interaction that it's service user led, service user driven and designed in a co-productive fashion with the clinician about the outcomes that both people want to achieve while the person is engaged in services. It's also very important that service users are involved from the design, the delivery and also the evaluation of all services by being involved in the actual design of processes, procedures and policies, in the delivery of the service they receive and the evaluation of the experiences of the services that they have received while engaging with the mental health services. But fundamentally, another step from that is the service delivery by service users while they're part of the service, that they can interact with other people who've been through a similar experience to them and being able to utilise the wisdom and knowledge that they've gained to help empower and achieve better outcomes and a better service for all.
I think it's very important that we take an organisational view of the development of recovery-orientated services. I think it's very much that we need to put the service user central to our decision making and both involve them in the design, the implementation and the evaluation of services. I think it's an opportunity to kind of enter into a true partnership with service users in order to develop modern services.
Well, I think one of the key areas of clinical practice or working as a recovery-oriented clinician is around developing a therapeutic relationship with people, engage people, develop that sense of trust. But to do that, you kind of need to create a sense of safety, giving people a choice and in being involved in the decision-making process. So in order to be able to work in a recovery-oriented way, I think one of the key things is around being able to actually see recovery in practice and witness it. So I think it is important to actually get involved in opportunities like co-production and co-education in order to be able to develop a hope in yourself and to instill that hope in the people that you see.